Good evening,
Hello.
everyone. Well,
Good evening.
yes,
Yes, yes,
good
good evening.
evening. Welcome to our webinar on preventives for common viral diseases, including dengue. I, Gargi Kohanioki, faculty of the Bhawanipur Education Society College, welcome you all for this webinar. Right now, since last 6 months, we all are going through a very weird situation. We are going through a particular situation which we have never faced before. Certain terms like quarantine, home isolation, all this not familiar to us. But now this is becoming very normal to us. We all are. There are two kind of people right now who are very casual and those who are panicking about the situation. So it's very important for us to know what actually we are going through. What are the precautions? What are the preventives that we should maintain instead of doing panic, right? So we already are very scared. We all are very uncertain that what is happening, how it's happening, what we should do and what we should not do. In different social media, we are accepting various theories, knowledges which are actually baseless. So here in this today's platform, we can actually ask, we have people with us who can actually guide us, who can motivate us and who can make our life better. So here I welcome the eminent speakers, doctors, our faculty members and our dear students for this webinar. So I would like to invite Dilip Shah, our Dean of Student Affairs, because we're very feared to invite someone who can guide us, who can help us in our institute. This is, I welcome sir. Please share your words about situation that facing right.
All right. Gargi, can I be heard?
Sir,
Can you hear
hear
me?
me?
Hello.
Yes, sir, you're audible. Yes, sir, you're
All
audible.
right. Well, friends, I think that this idea of having such a seminar was there in our minds since some time. It's just that we were not able to figure out the various people who could come in together. Gargi is a very spirited young lady and she does a lot of work. Even for coronavirus, she is quite a volunteer and she's taken a lot of activities and pains for NSS initiative. And it is under that banner that we are going ahead with this. We have Dr. Subhrojyoti Bhowmick and Dr. Shabnam Agarwal. Both of them are renowned practitioners in their own area of expertise. I need to acknowledge the efforts put in by our Professor Meenakshi Chaturvedi in getting them here. And I'm happy to see that 51 students are presently there. I might be wrong. Is that correct, or are there more people? Somebody can correct me. But I believe that we have that kind of a crowd. But the most important thing is that this is a very active, vibrant crowd. And this is the kind of crowd which wants to do things. They want to spread awareness. In fact, for the doctor present over here, I must tell them that we also have one group of students. They call themselves emergency. There are about 12 or 15 of them. All that what they basically do is that anybody in any kind of problem, whether they want medicines or they want supplies or they want anything, these boys actively try and manage and get things done for them. So we have those kind of boys also who are present. So a lot of good things are there when there are more problems than just corona. By this time, I think that a lot of information about corona has been shared and a lot of us are practicing that. But there are so many more problems, including dengue, which is also becoming quite a menace. In fact, I am reminded of a talk given by uh, Bill Gates in 2015. He said that we are prepared for so many eventualities in the world. In 2015, he was giving a TED talk. He said that in case there is any kind of an outbreak of any kind of pandemic or any kind of crisis of this order, then so far as the health sector is concerned, we are not as equipped as we are equipped in so many other spheres of life. And this is where we need to put in our efforts. That was in 2015 that he said. It's on record because it was a TED talk. So I think that time has come that we take care of our health and we take preventive measures because prevention, as we all say, is better than cure. So let's try and see what the doctors have to tell us to fight against the viral diseases that are presently there in the society. And dengue also is something that is attracting everybody's attention. There must be many more. The doctors and the experts are there. And we are all here to learn and to share the learnings with our friends who are probably not present today, but we can tell them that these are the kind of outcomes. We also have the recording which is being done, which can be shared with the others also. So with those words, I welcome the doctors and the students, and I acknowledge the efforts of Gargi and Meenakshi ji in putting this effort together. This is probably amongst the few steps that we have taken so far as healthcare is concerned, but this is not the way we are going to rest. It's a stepping stone, and better things and more vibrant activities in this sector will certainly follow. So, with those words, welcome, and I want all the students to at least for once switch on their videos so that we know it's easier to talk to faces than alphabets. So if you can just switch on your videos for a moment, then I think everybody will be happy. And after that, I think with those words, uh, over to Gargi. And Gargi, please introduce the speakers in detail
Thank
and
you.
please take it from there. Thank you so
Yes.
much. Thank you.
Thank you so much. Thank you so much for your kind words. Okay, now before we start the session, before I introduce the speakers, we are sharing a link, a poll link with you. This is for just basic awareness that what we think. So just two questions are there. Just write your name and post and just answer those questions. Those two simple questions are there only. Let's not make this webinar a boring one that we will be speaking, here the speakers will be speaking and you'll just listen to it. Let's make it interactive, answer, participate. You all are the participating here, you are all are the participants. So let's get involved and answer those poll and we'll reveal that answers the poll, where it's going, where the public poll is going. Okay, we will sharing this link in a while. Now, I would like to introduce Dr. Subhrojyoti Bhowmick, Clinical Director of Academics, Medical Quality and Clinical Research, Peerless Hospital B.K.Roy Research Center. Dr. Bhowmick is a medical graduate from Calcutta University with a gold medal. He has completed MD in pharmacology and has over 13 years of experience in the field of clinical research. He has a certification in clinical research administration and project management from Stanford University, USA, and in patient safety from Johns Hopkins University, USA. He is the first Indian doctor to be awarded the prestigious Lucian Lip Patient Safety Fellowship by ISQEA UK for 2019. He has been conferred the honorary lecturer position at the Institute of Clinical Sciences, University of Birmingham, UK, for his contribution to clinical research and healthcare quality in India. He has been awarded as the most promising healthcare professional in patient safety by the Asian African Chamber of Commerce and Industry in October 2018. He worked at Stanford University School of Medicine, USA as a senior clinical research associate from 2016 to 17. He has recently engaged as consultant programs at McCourt, which is the state-of-the-art university. Currently, he is clinical director of academics, medical quality, and clinical research at Peerless Hospital B.K.Roy Research Center as a director. Dr. Bhowmick, a warm welcome to our work. I would
Thank you.
a very warm welcome on behalf of the entire. Okay, so please help us to know viral diseases in light your knowledge. It's over to you, Dr. Bhowmick.
Yeah, thank you, guys.
Dr. Bhowmick, I'm stop sharing
Yes,
my screen
yes.
so that you can
That
share
would be
your
really
screen as
nice.
well.
Thank you, Gargi, for that wonderful introduction. And respected Professor Dilip Shah, the Dean of Students Affairs, and respected Meenakshi Chaturvedi ma'am, and dear students, it's a great opportunity for me to come and present my presentation on the common viral diseases. And I would like to thank the Bhawanipur Education Society for this opportunity. as well as I want to thank Peerless Hospital for giving me this opportunity to present my views. Am I audible? Yeah. Okay.
Yes, sir. Loud and clear.
So,
Yes, Bhowmick, you're
yeah,
audible.
can you hear? Can you see my slides, please? Okay. So
Yes, sir.
again, as I mentioned,
Yes, doctor,
yeah.
it's visible.
Again, as I mentioned, thank you very much for this opportunity. Want to thank the very reputed college, Bhawanipur Education Society, for having this program. And when Meenakshi madam spoke to me, I think I really want to congratulate the college leadership for having this kind of an initiative, which empowers the youth of the society to take their decision on how they would like to manage their health. So at Peerless Hospital, we believe in preventive healthcare more than curative healthcare. But then as a hospital, we have taken a lot of initiative to cure diseases. So my talk is going to be on preventive strategies on common viral diseases in monsoon. So viruses have been in existence for millions of years, and they are older in when it comes to hierarchy. Or in history, they are older than the bacteria. So not many people know that viruses are older in lineage. So with the world, when the world was formed from black hole, the first living organisms were viruses. So the viruses has existed in this world when nothing else existed, and 60% of all human infections in the human bodies is contributed to different kinds of viruses. The peak of viral infection comes around this time, around July and September, and we have studies from India that which mentions that the around monsoon, which peaks around July, August, September, it coincides with viral influenza in Delhi, in Lucknow, and I see the name of Calcutta also. So, lot of patients which we see in our hospital have these other common viral illnesses, which I'm going to talk about in my next few slides. We all have become corona expert, and as Professor Shah was mentioning, it's true. Thanks to the media that every day, every minute, every hour we've been listening about COVID-19 signs, symptoms, testing, medicines. So I think if we really do a cross-sectional study at this point of time, all the 50 students will be able to give majorly correct answers on how a COVID-19 patient will present or what kind of treatment protocol is being followed. But what is not done on a regular basis is interaction, is healthcare communication between the healthcare professionals as well as the common people and the media about other illnesses. A major chunk of it is actually viruses. So I congratulate the college again for this initiative. Viruses are probably the most common cause of infectious diseases, and many of them are acquired within the indoor environment. So you might not have to go out, but you might just acquire it in your environment. And why this happens more during the rainy season is because large amount of microbial contamination happens, and more so contamination happens in the water which we drink from the enteric viruses. So meaning of enteric is related to the intestine. So there is a lot of mixing of the dirty water and the clean water when there is so much of rains. You've seen Calcutta has witnessed so much rains in the last 72 hours. More rains are expected in the next 72 hours. So what is happening is there is a sewage overflow, and the clean water is mixing with the sewage water, which is the unclean water which comes from your bathrooms, which comes from your kitchen. So there's a lot of mixing which is happening and the clean water is getting contaminated, and as a result of which drinking of such unclean water can result in the viral infection. So what causes the surge? If you really see that the respiratory infections have been long appreciated, and there is a swing or there is a surge of respiratory infection, and this data is as old as the 20th century. So early 1900s, we have found in research that the respiratory infections, the common colds, the headaches, the nasal blockage, these are going to increase when the monsoons come in. There will be upper respiratory tract infection. The colder weather helps the virus to become more stable. We have just passed summers. We have entered the colder, and the humid monsoons, and these enables the virus to become very stable, and the host defense mechanism also falls. What is the host? We are the host. So virus is an external agent. It's a foreign agent. It wants to enter into the human body so that it can replicate in the human body, and that is the reason it is called a host, because the human body hosts these viruses, and the viruses replicate, and when they replicate, they cause a lot of destruction, a lot of inflammation in our organs in which they grow. So there is clear-cut scientific data which mentions that influenza viruses increase in the surge increases for influenza in the monsoon region. This is a schematic diagram of how there is interaction happening between the virus factors and the host factors. As I mentioned, the lower temperature, it stabilizes the virus. There's more chances of the virus to spread through droplet and through the deposition. And during monsoons, we tend to remain inside our houses, so there is always a chance of decreased airflow and recirculation of the air. So we always run a chance of getting the infection from anybody who is contaminated with that infection. When it comes to human factors, the respiratory secretion and viscosity plays a very, very important role. The elderly people, the viscosity is less. In the children, the viscosity is less. So you will see that these two age groups, they suffer from a lot of cough, colds, and other infections during the rainy season. And there will be nutritional deficiencies because many of the times, hello? Hello, can you hear me? Hello?
Yes, sir.
Yeah, okay. Yeah, I just got an echo. So yeah, it's very yeah, so thank you. So, and some nutritional deficiency because, you have this Sawan ka mahina and all that. So I'm sure Sawan, many people are starving because it's a very pious month for Shivji, which we know that, people are not drinking, they are not eating a lot of nutritious food. So this results in the monsoon season that the host defense mechanism falls down. And of course, we have the weather related social behavioral changes. Sometimes we feel like eating outside. We go and we have contaminated hands. As I mentioned, we drink contaminated water. So this interplay increases a lot of infection in the human beings. So what are the common viral diseases which we should keep in mind, apart from, of course, what COVID-19 is sweeping across the country? Number one on the list is dengue. Number two is chikungunya, which is also very common. There could be other viral fevers, which is not dengue and chikungunya, but they may produce a lot of problem in some of the patients. The commonest of them would be influenza, the commonest cold and flu, where you will see patients just coming to you with constant coughing or constant sneezing, and they will have a severe headache, eyes are red, nose are red. When we look at the gastrointestinal tract, the liver, there could be viral hepatitis. And finally, there could be viral diarrhea. So these are the few basic things which we should be very careful about in the monsoons, because there is usually an outbreak of these diseases which are seen during the monsoon. So coming to dengue, dengue has been in the news for a lot of complication this disease cause. And, we believe that when it's monsoon and Durga Puja is about to come, the dengue season peaks. In fact, it's the last few years we have seen that the peak comes down when Durga Puja starts. So this is exactly the time when dengue will be hitting us, because there's a lot of water which is getting accumulated, and the Aedes aegypti mosquito, this is the culprit which causes the disease. It's a very, very bad mosquito which infects. When it bites, an infected person carries the blood in its stomach and carries the virus in the stomach of the mosquito, and when it bites a healthy person, it throws that virus into the blood of the healthy person. And the viruses, as you know, the dengue virus is very fast in replication. It replicates in a geometric progression, and it increases lakhs and lakhs of copies inside the human body, resulting in high fever. There could be rashes across the body, severe headache, low platelet count. I apologize for the spelling there. Low platelet count, and there could be hypersensitivity reaction. That means some of the patients can actually present with respiratory distress. That there's so much of reaction in the respiratory tract, there could be hypersensitivity reaction. So be very careful that you have fever right now. We are very conscious that we will have COVID-19 as one of our first diagnoses, and we get tested for diagnosis. But this is the time when dengue is also hitting us. We have to be extremely careful. And the other important thing about dengue is that dengue can produce severe body ache, extremely bad body ache. The patients who have suffered dengue, they know that their body ache is going to be really, really bad. Sometimes this is known as the bone-breaking body ache. And so this is really bad. And as I mentioned about the low platelet count, what does the platelet do in the body? The platelet helps in, if there will be coagulation. This is very important, that when the blood is coming out of any of the body, if we have a cut, then the blood is stopped from coming out by these platelets. So if the platelet counts reduce in the body, there is a tendency for hemorrhages. That means bleeding can happen from anywhere in the body. So patients can bleed from mouth, patients can bleed from nose, patients can bleed from the genital tract, and also sometimes if the patient is very unlucky, the patient can actually have bleeding into the brain. So we have to be very, very careful when we are dealing with dengue. What are the dengue specific preventive measures? I think the most important thing, and as Professor Shah was mentioning, that your students take a very active role in the community. So this is a very important thing, that you have to break the chain in the community. We have to use insecticides, we have to use the insect growth regulators, and these I'm not going to get into the details, but cleaning of your surroundings. No water should be accumulated. Nowhere, let us look at our roofs. Let us look at our AC chambers. Let us look at our sports room. Let us look at the pots which are in the college campuses. Some of the pots might have plants. Some of the pots might not have plants. Let us look at that beautiful fountain which is probably not functioning right now, and see if it is accumulating water and dengue, Aedes aegyptis larva is growing or not. So let us clean the environment. And so it is very, very important that people should clean the environment. They should use insect repellent in your houses if you can, because you need to beat the virus. If you need to beat the virus, you need to break the axis between the mosquito and the host, which is the human being. People need to wear full sleeve clothes during the daytime. And let me tell you, the difference between the dengue mosquito and the malaria mosquito is that the dengue mosquito is the one which will bite you during the daytime. So if you are seeing that you are being, you are bitten, or you see mosquitoes roaming around in the daytime, be very, very careful. These could be actually Aedes mosquito. They are called the tiger mosquitoes. They are very big in size. So if you see around your area where you live, or where you are studying, or where you are, if you come to your office, you come to your college, and you're seeing that there are mosquitoes around, please take proper precautions that these mosquitoes should be clean. And it breeds in clean and fresh water. So any breeding should be stopped. Any water accumulation should be avoided. One of the commonest places where such water accumulation happens is your AC ducts, your AC, your big chambers, air conditioned chambers. So be very, very careful that that water accumulation has not happened. The other disease now is the chikungunya. Chikungunya is also another viral disease. It is It is also by another species of Aedes mosquito, Albopictus. But one of the important symptoms of chikungunya is that along with high fever, patients will usually come and tell us they have joint pain. And immediately when they say that they have joint pain, we think of chikungunya or at least dengue. So we get those tests done. Patients are going to also have chill. That means you will feel very cold and the temperature going up very high. So always have an index of suspicion that, not every fever is going to be COVID-19. Be very, very careful, if you are, if because as a citizen, if you are coming across any patient or anybody in your home who is having chill, rigor, severe body ache, or a severe body pain, chikungunya could be one of the possibilities. And the most important thing is that the safest medication here could be paracetamol. Please don't give aspirin in these cases, because both in chikungunya as well as in dengue, aspirin or Disprin, I will name the brand Disprin. Don't give Disprin, because Disprin causes lowering of the platelet count. Paracetamol is a much more safer medication. So if you're not able to find out, at least try and reduce the fever till you can consult your doctor. Always use paracetamol, and don't give Disprin, because Disprin can produce a lot of complication. Again, the preventive measures, I think insect repellent is required in chikungunya, because these are caused by the mosquito bites. Wear long sleeve shirts, pants, and try to cover your body as much as possible. We should use permethrin. This is an important insecticide. And if some of you, when we are all living in these complexes, in our house complexes, we have huge complexes in which we live. So let us just look around on those fancy complexes. If there are accumulation of water, just try not to accumulate them. Once a week, let us take an initiative to go around these complexes. Let's empty and scrub the pots and whichever where water accumulation is happening, which is going to be a very, very common feature during these monsoon seasons. Let us look at those tires, those buckets, those planters, those toys which are lying around on our basements where the water is getting accumulated. There could be these tires and these toys and these trash containers and the flower pots on our rooftops, because you might be living in a very huge house. You might have a beautiful roof, but you have accumulated a lot of trash there. The water gets accumulated. So be very, very careful. Go around once a week, go around your facility and take care of yourself. There could be other viruses which can produce viral fever, and I'm not going to get into details because this audience is not a medical audience. So there could be other viral fevers. Adenoviruses are very common in case of monsoons. They can produce fever, fatigue, dizziness, weakness, body chills. So I would say that you can probably start paracetamol, but don't self-medicate. Don't self-medicate. Always get in touch with the doctors and get your doctor to speak to you. You speak to the doctor. If required, many times you might not find the doctor. You might have to, access the doctor through telemedicine facility. I'm going to talk about that facility in my subsequent slides. So nowadays, Indian government has allowed telemedicine. Get access to your healthcare doctor, to the doctor you want to refer to or talk to through telemedicine. Again, I would say the preventive measure for viral fever would be to not get soaked in rain as much as possible. Don't stay in wet clothes for a long period. Wash your hands very often. Now, this is extremely important that you wash your hands, because we contaminate through droplets. In Corona also, we have been continuously saying that these hands are your biggest enemy, because we are actually going to touch with the help of these hands, the mouth, the nose, and the eyes. So the viruses, they are so powerful. From the hands, they directly enter into the mouth, they enter into the nose, and enter into the eyes. And these are all mucous membranes. These absorb the virus, and the virus replicates and spreads across the body. So we have to be extremely careful that we don't touch our fans. And that is the reason in coronavirus infection, we are saying use the mask. So we have to hand wash very frequently. We have to do our immunity booster with the help of vitamin C rich foods like lemon, like amla. I would say chamanprash. Have one teaspoon chamanprash every day. Green leafy vegetables, spinach you can have. You can have spinach every day or every alternate days. And you must keep safe distance. Now, this is again COVID-19 coming here, that but all viral infections spread majorly by the droplet infection. So, do gas ki duri, that's what our Prime Minister has said, do gas ki duri is extremely important. If you should care for the person, but then don't get mixed too much. Try, and somebody is not well in your house, try and isolate that person for any viral infection. And again, I would highlight the importance of adequate hydration, because when the person has fever, when running 101, 102 degree Fahrenheit, you're losing a lot of water. And as a result of which you are getting hot again. So keep drinking at least 2 to 3 liters of water. And if you don't feel like drinking water, have lemon juices, have different kinds of juices which you like, so that your hydration is maintained. Influenza is very common. Influenza is the name of a virus which causes cold and flu. There is a sudden change in the weather, and this we are witnessing. Today morning, this was a bright sunny day, very humid, 35 degrees Celsius. By the time you come out or you're ready to go out to do some work, the temperature shoots down to 25 degrees Celsius, and there's heavy rain going on. So this fluctuation in the temperature is a main cause, and the immune system weakens down. I've told you that the reasons, and we become vulnerable to cough, cold, and flu. And if you have simple influenza, you will have fever, which is not going to be very high, but you will have aching muscles. You will have runny noses. You will you lose a lot of water through your noses. You're going to sneeze a lot. So if you see a patient who's sneezing a lot, I definitely would say that please wear a mask inside your house, so that they don't contaminate others. They through these droplets only, these patients are actually contaminating the houses, contaminating the surfaces, and you, with the help of your hand, will be contaminating yourself. There'll be a lot of congestion in the nose. There'll be a lot of congestion in the lungs. Influenza, we are very, very, we can take, we have to be very careful when the influenza hits the elderly population, because many a times influenza has the same mortality rate, or I would say same death rate like how COVID-19 has. So influenza, luckily the healthcare has a vaccine for influenza. So if any of you wants to take an influenza shot, please go ahead and take an influenza shot, because vaccines are readily available for influenza. So let's go to the other viruses, which are hepatitis A virus, and these will spread through drinking contaminated water. As I said, sewage water is now mixing with the clear water which is underground. So be very, very careful. We have to have, and this contaminated water we probably might not understand, because the water might look very, very clear, but it has virus in it. So don't eat raw vegetables, directly vegetables or fruits from the market, because they might be contaminated during handling, and this infection might spread. So the organ which is affected by hepatitis A, as you can understand, hepa means liver, titis means inflammation. So it is caused by the type A virus. There are different kinds of viruses. Hepatitis A spreads through contaminated water and contaminated food. So I'm talking about this. Hepatitis B spreads through blood. We are not going to discuss this because it has no correlation with monsoon. When the patients, we always have a high index of suspicion of patients having hepatitis A when they have nausea. That means you're feeling like vomiting. You're vomiting. You have fever. You're feeling like vomiting. You're vomiting. And anorexia means loss of appetite. You don't want to eat at all. You'll be malaise. That means you don't feel like doing anything. You just feel like lying down. And there'll be abdominal pain, more so on the right side of the abdomen. So these are few situations where we have to keep in mind that, okay, this patient might be a hepatitis A infection. Within the few days, couple of days, the patient will develop dark color urine, so much so that the urine will become mustard color. And the color of the stool changes from the normal color. The stool will become clay colored stool. So this is absolutely pathognomonic or characteristic, and patients will suffer from jaundice. They will become yellow in color. So this is a very common disease during the monsoons. And how do we prevent it? Don't drink water which you're not sure of. Don't eat food which you're not sure of. Eat home cooked food as much as possible. Eat properly boiled, or I would say properly disinfected water in your house. So you can, so what does the WHO say about prevention? I think the most important is improving sanitation, which is of course a challenge in a developed city like Calcutta, because certain areas are not properly, sanitation is not proper. So hepatitis A is a reality in certain areas in Calcutta as well. We have to ensure food safety. So we have to be very careful from where we are picking up our food, and we have to immunize ourselves. Again, a vaccine is available for hepatitis A, and it's being now included in the national immunization program. But the age of the students which I am seeing right now, probably they might not have been vaccinated, because hepatitis A vaccination just started 10 years back. So if you feel like you can get a shot, talk to your doctor, get vaccinated for hepatitis A. Practicing good hygiene, and very, very important, again, hand hygiene is so important. When you're coming from outside, when you're doing some work, you might have just shopped and you've come and you're feeling very hungry. Don't eat at that point of time. And vaccines, as I mentioned, are they're available. Viral gastroenteritis, this is another way where you will have loose stool, and enteric means anything related to enterum, means anything related to your intestine. Rotaviruses, adenoviruses, astroviruses, noroviruses, you name them, you have them. I don't want to name them and don't want to scare you, but a lot of patients and a lot of you might have, undergone, you might have eaten something and you might just go into a bout of diarrhea. So this is because the virus might have entered into your body, any of these viruses, and they might have caused diarrhea. So rotavirus is primarily seen in children below 5 years of age. So if you have young children, especially below 5 years of age, ensure that they've got their rota vaccine, because rota vaccine is now given through the national immunization program in India. Noroviruses affect people of any age, and they are the leading cause of foodborne diseases, and primarily found in case of chicken sandwiches. So I don't want to name this, but yes, if they're half baked or half cooked chicken sandwiches, noroviruses have been found to be very, very common. Diarrheal diseases, of course, are very common in Southeast Asia, and and India is not an exception. Patients will suffer from loose stool, abdominal cramps, fever, bloating. That means you don't feel like eating, your stomach just swells up, you will feel like nausea, and you might have blood in the stool. So the most important thing is avoid eating raw salads, because many a times when I've seen and talked with my patients, sometimes they have said that, yes, you had this craving of having the salad in one of the, very big outlets within a pretty posh mall, but try avoid salads which are being prepared outside, because they might be contaminated. And also roadside food. This has become difficult now with the COVID-19 coming in, but the roadside food may trigger a lot of diarrhea, especially I would say contaminated water in fuchkas. So be very, very careful that you might run into diarrhea after having them. And one must drink clean water, or boiled water, or water purifiers. For people who are students living as a paying guest, if you don't have a water purifier, get a water purifier, or at least boil your water and drink it. Again, I would say hand hygiene is extremely important. Hand hygiene will prevent you from a lot of infection. 20 seconds is what you need to wash your hands, and not less, not more. And there are 6-7 steps which you have to perform. If you are not able to reach out to doctors, the easiest way is to access through telemedicine. That is with the help of your smartphone. You can access Peerless's website. I work at Peerless. Peerless has started this doctor's consultation, where you can directly through the website, you can get in touch with any doctor you want to talk to, and we can arrange the doctor's consultation by when you are sitting at home. So telemedicine has been made legal in this country. March 2020, coronavirus resulted that doctors can communicate, they can treat patients through WhatsApp, they can treat patients through Skype. So we have started the same at our hospital. So few last words about immunity boosting. It's very, very essential, as I mentioned, that, we as host boost our immunity, because boosting the immunity will help us fight the viruses. The very, very important is take multivitamins, especially vitamin A, because it helps to regulate cell division and helps to regulate the cell to fight the virus. Zinc is now been recommended, and let me tell you, the zinc role in COVID-19 is not very well proven, but zinc role is very well proven in influenza virus. And because coronavirus and influenza virus belong to the same family, we believe that zinc plays a very, very important role in boosting the immunity. So as Professor Shah mentioned, prevention is better than cure. I'm going to echo his thoughts to end my presentation, that please prevent these diseases. They are easily preventable. Drink clean water, use boiled water, use water purifiers. Always clean your hands and use hand towels, and you should cover your mouth and nose with, if somebody is coughing and sneezing. I think this is something which we need to learn in our country, because we are not very conscious about the person who's sitting by our side, or we are pretty conscious about ourselves, but time has come. COVID has shown us that we need to be conscious for the society. Let's cover our mouth and nose with a handkerchief or a tissue paper and throw it properly, discard it properly. We have to use mosquito repellents, nets, and we have to, especially dengue, because it bites us during the daytime. And we have to take, I would say, go around our facility once a week to see if water is getting accumulated or not. Stop that accumulation and do this proactively. Avoid eating out as much as possible, consume as fresh as possible, and use hand sanitizers while traveling. So these are my references, which I use for preparing the presentation. And with this, I would like to end the presentation. And if there are questions, I'll be more than happy to take them.
Thank you. Thank you so much, Doctor, for your enlightening speech. There are questions for you. First of all, Meenakshi ma'am wanted to ask, she said that she had a question. Ma'am, please start. We can start with you. Please ask your question.
Thank you, Gargi.
Yes.
Thank you, Doctor, for such a beautiful presentation and for such a intricate knowledge on the various viruses. I was really keen, but there were certain questions which were going in my mind. Can
Yes.
I ask more than one?
Yeah, go ahead.
Thank you, sir.
Yeah.
There are certain very basics that I wanted to ask. First of all, we are hearing about the isolation, even you referred to it. Whether in all type of virus, the isolation is necessary.
Yes, it is extremely necessary, madam, because as I mentioned, what is isolation? Isolation means I am breaking the chain of the virus replication. So when I isolate, I am a host. I separate myself from any other host which I could infect. So as I mentioned about influenza, I mentioned about other viruses except for the enteric viruses. That means which spreads through the food. Apart from that, any other respiratory virus, they spread through droplet infection. So when I'm speaking, I'm generating droplet. When I'm sneezing, I'm generating droplet. When I'm coughing, I'm generating droplet. So it is always better that if I have such kind of a patient, I isolate that patient. Need not be in a hospital. It could be in a room. If I have a small house, let that patient wear a mask and isolate himself or other, because we need to break the chain of transmission. That's extremely important in all viral infections, which spread through droplet infection.
Thank you, Doctor. The another question which was worrying me, actually one of my colleague has got dengue, and he was admitted to the hospital last night, and we were very worried because about the low platelets, what he has been told, that the platelets has gone very much down, like about 70,000 it was yesterday. And so he was admitted to the nursing home. I wanted to ask that when the dengue comes up, then how do we know, and what is the time when we really need to go to the hospital so that to get ourselves admitted? Is there any early sign of it so that we can know about it? And is there, or there are other precautions, or is there any other particular medicine that we can take for the betterment of the platelets or for the situation in dengue?
So that's a very good question, Meenakshi ma'am. I think the most important thing is to have a high index of suspicion that this could be anything but dengue. As I mentioned, if you have somebody you've seen who's running a high fever and has severe bone ache, has severe body ache, and just if you notice the skin, I mentioned there could be rashes. If you see that there is a rash with very high fever with severe body ache, it is better to consult your doctor, the home physician you are referring to, because it is not the time to go to Dr. Google, because Dr. Google will give you 20 diagnoses, and even he will say it could be a case of blood cancer, because that is how Dr. Google gives us. So it is always better that we refer. As I mentioned, sitting at home, if I'm not able to reach out to my doctor through telemedicine, now in India it is available. Through telemedicine, we reach out to the doctor. Doctor is going to ask us for certain tests. As you correctly mentioned, platelet count is going to be one of the tests. Apart from them, we do what is known as the antigen, NS1 antigen. That means we want to detect whether the virus is present in the blood or not. And if the NS1 comes positive, we stamp this as dengue positive. And platelet counts, no medications which will be given to improve the platelet counts have to be given under observation in the hospital. So I'm sorry to tell you that we cannot prescribe, or I cannot share anything which will be available over the counter, because it is only available through doctor's prescription. What I can tell you here is that please don't take Disprin. Don't take Disprin in any high fever where you are not sure of the cause of the fever. You can take, I don't want to take the name of the brand, but it is paracetamol, Crocin. Crocin is which we are usually taking. So you can take that, but don't keep taking yourself and become a doctor. Let us do our job.
Thank you, doctor. One more question, which was not related to dengue actually, but which is going on very frequently, like in all the complexes or here and there, we are hearing about the COVID tests. And there are something that we heard even about the fake test. I'm not going to name the hospitals or something where I know that they had given the report as positive, where it has gone negative later on for the whole of the family. So we heard something about ICMR, that unless and until the test is, there's an approved lab by the ICMR, we should not go for the test. Whether there are, the test for every type of test are to be done by such labs, that's the number one. Secondly, for the COVID, are there any specific labs in Calcutta where the person can go for the testing which are approved by ICMR?
So that's an again great question, and I don't want to get into controversy by naming few hospitals which did this,
No,
but I can
I don't want that as well.
I can tell you on behalf of Peerless Hospital, our management commitment was that we will not go in for home collection, and I'll tell you the reason why. We at Peerless Hospital are committed for good quality testing. Our labs are NABL accredited, that means accredited by ICMR and NABL, both from the government of India, the COVID testing. The reason why we didn't go, because we were brainstorming, and why other hospitals went, and what is the issue, that this is a very delicate virus. COVID-19 virus is a very delicate virus which has to be collected at home and taken to 5 kilometers, 10 kilometers distance to a laboratory where this has to be tested. So they have to be tested in they have to be taken through a viral transport medium. They have to be kept, those swabs. The question is, are you able to manage this chain? If you're not able to manage this chain properly, the proper collection and the viral transport is not proper, then a positive case will come negative. A negative test can come positive. So the hospitals which probably have done these things, let me tell you, I would say I will have a serious concern that their collection methodology was not correct. And that is the reason in our hospital, we are collecting it. Anybody who wants to get the testing done, they are welcome to come. We have a separate fever clinic. The physician checks you in the fever clinic. We have the testing facility not only by two methods we are using: RT-PCR method, reverse transcriptase polymerase chain reaction, which gives you the results in 12 hours. And if somebody is in a hurry to know in 1 to 2 or 3 hours, we are using the Gene Expert. Both of them are approved by ICMR. We are one of the only hospitals in the city of Calcutta which has both the testing facility. Not many hospitals have both the testing facility. And if anybody wants to know which all other sites are or labs, as you asked me the question, you should always go to the ICMR website, because the ICMR maintains a repository of the approved labs which they have approved in the state of West Bengal and in the district of Kolkata. So every district, there is a strict monitoring by ICMR, and we are monitored. We have to send our reports to ICMR on a daily basis. So that quality control mechanism is running properly at Peerless Hospital. So I can talk about my own hospital. You are more than welcome. God forbid, if sometime you require it, you can always come to our hospital. But we believe in principle home collection should not be done, because there is a high chance of contamination and wrong report giving. So we are not doing it.
Thank you very much, Doctor. I think there must be with others also a lot many queries.
Yes, ma'am.
So
There are many
probably I
questions.
should give the opportunity
Yes,
to
ma'am. We
others.
will take a few because we can't take all the questions, Doctor. This question comes from our respected Professor Dr. Rekha Nariwal, and she says that, does speed generate droplet? If there is high palpitation, what is the cure and the reason?
What is the last part of the question, Gargi? Can you repeat that?
Yes,
Why
yes,
got?
sure.
Yeah. Yeah.
If there is high palpitation, what is
Yeah.
the cure and the reason?
So thank you, Professor, for that question. I think our biggest misfortune is that Indians spits when the Indians are in India. But the Indians don't spit when they are in Singapore, because you get fined 500 Singaporean dollar. So that is our biggest misfortune. Yes, when you spit, it generates droplets. It generates a lot of viral load. And let me tell you, India's national disease is tuberculosis. Like we have a national animal, tiger, we have a national flower, lotus. India's national disease is tuberculosis, because out of 138 crore people, 100 crore people spit on everywhere where they find the opportunity. And that is the reason we have not been able to eradicate tuberculosis in our country. So unfortunately, yes, spit generates a lot of viral load. Madam asked about if there is palpitation. Madam, without knowing proper clinical history, I will not be able to answer that question. I think that can be taken on a one-to-one basis. Palpitations are anything where you are aware of your own heart rate. It can happen for multiple reasons. One, we need to get your heart checked. It can be a result of ischemic heart disease, can be a result of increased hypertension. It could be a result of your thyroid disorders if you have those. So I think right now let us discuss at general topics, and one-to-one discussion. You can always reach out to Peerless Hospital through the telemedicine numbers or our marketing people who have got in touch with you, and we will be more than happy to help you.
Thank you. Thank you so much, Doctor. Next question from Ronak Doshi. How does air transmission flows from person to person in being home also?
Yes, I think Ronak asked a very good question. And, many of us, the strata of society where we belong to, we use air condition at least, 10 to 12 hours in a day. So air condition recycles a lot of air. And, that's where the problem lies, that contamination happens more in air conditioned environment. And as I mentioned, the droplets happen when I'm speaking. Right now, when I'm speaking, I'm actually spitting out saliva, which I'm not able to see. You are not able to see when some of my respiratory secretions are coming out. So droplets do happen, and they fall depending on the extent on how I speak, how I cough in my environment. And these droplets are not visible. They lie on the surfaces, and I can touch them. I touch them, and once I touch them, if I don't do my hand hygiene, I can touch my face. I can just tell Ronak that there is a study which is done in the University of Michigan, which has showed that an average human being touches his or her face 2,000 times in a day. And that is the result that we are now asking people to wear these masks. Why we are asking people to wear the mask, because at least we will not touch our nose and mouth when the mask is present. So contamination happens in the internal environment more so because we become callous, more so because we take that nothing is going to happen, chalta hai type, it's our house and no infection will happen. But that is not the case.
Okay. Next question from our professor, Dr. Vasundhara Mishra. What will do sinus patients? Please tell about this.
So, madam, sinusitis increases during these phases, and they can be viral sinusitis because sinuses are nothing but these are hollows these are hollows in your skull bones, because the skull is very heavy if the bones had to be all total bones. So God made them hollow, and so that the bones can align with each other and can hold the brain. So if these sinuses get infected, they have a mucosal lining, they can get infected. They get more infected during monsoons because monsoons have high humidity quotient and high bacterial count, high viral count. So if they get infected, you have a treatment methodology. I think you have to get regular inhalation. You have to take antihistaminics. If you have a bacterial sinus infection, which of course your doctor is going to decide, you will have to take antibiotics depending on your susceptibility and your sensitivity. So I think it has to be very, very individualistic. This is on the broader aspect.
Okay, thank you so much, doctor. There are other questions also, but our other speaker is also waiting. Maybe
Absolutely.
at the end of the session again, we can come back to these questions. Please
So
be with us.
Gargi, I would have to excuse myself because I have my chamber from 6 o'clock, so I will have to excuse myself. If there are any
Okay.
questions, if there are any questions, you can send it across through our colleagues here, and we will try to answer them. But again, thank you very much for this opportunity. Please stay safe and take care of yourself as well as take care of the society. Thank you.
Thank you so much, doctor. Thank you so much. Thanks, Atan. With this, we'll just move on to our next speaker. Dr. Shabnam Agarwal, Director Education, Lopani Group of Institution, Chief Physiotherapist, Belle Vue Clinic. Dr. Agarwal is a specialist musculoskeletal physiotherapist practicing in Belle Vue Clinic, Kolkata, as the chief physiotherapist since 25 years. She is a member trustee of Nopani Group of Institution, which includes a postgraduate level College of Physiotherapy affiliated to the West Bengal University of Health Sciences. Dr. Shabnam is on the PG Board of Studies of the UBUHS also. She is the honorary consultant physiotherapist to His Excellency Governor of West Bengal. She served as a member of the Central Scientific Committee, Indian Association of Physiotherapists from 2004 to 2006. She is one of the founder members of the Society of Indian Physiotherapists and the editor of Journal of Society of Indian Physiotherapists. She is regularly invited as a panelist, speaker, or moderator in the international, national, and regional conferences. She is an examiner of postgraduate courses, masters, and PhD at several renowned universities. Dr. Agarwal, warm welcome to our webinar. Can you hear me?
Thank you, ma'am. Thank you very much. And
yes, ma'am, would you be presenting or ma'am, would you be presenting or I will present on your behalf?
No, I'd like to present. Thank you.
Okay, thank you. I'll just stop sharing my screen.
Sure.
Before ma'am start, dear participants, if you have any questions, then please place it in the chat box. Thank you.
One second, just do this. Am I audible and is this visible?
Ma'am, you're audible, but the screen is it's showing blank.
Oh, okay. But it's all right.
No, we can see her, Gargi. We can see
I
her.
can, yes, we can see the screen, but it's just white. It's just a white background. We can see, doctor.
No, no. Actually, we can see her. I can see Gargi. I can see her.
No, can you see my screen, ma'am? I've
Not yet.
started the presentation.
Yes, it's
Not
visible,
yet.
doctor.
Sorry, ma'am.
Not yet. I think you'll just begin. I can see the presentation. That screen. Yes, I can.
Ma'am, your
Maybe.
screen is, ma'am, just start the presentation. Your screen is visible.
Yeah.
Oh, it is?
It is.
Okay, great. And so this is, thank you so much, Meenakshi ma'am and Gargi ma'am. Thank you very much. And I thank the management of Bhawanipur Educational Society for inviting me for this webinar. It's always great to speak to students and faculty because I interact with them on a daily basis. Although I'm a clinician with 25 years of experience in Belle Vue Clinic, the academic and researcher in me enjoys teaching, lecturing, discussing, and a lot of research projects. So when I was asked to speak on preventives for common viral diseases, I was wondering what really should I speak about, because seriously, I mean, Dr. Subhrojyoti has given a wonderful talk, and I think he's, in a way covered all the diseases. So I've kind of made it a bit more easygoing, a bit more student friendly, and I would really like the faculty and the students to interact with me on this so that we can take this ahead more like a discussion than me giving a lecture and you listening to it. So the reason, like, of course, this looks pretty, but it is the coronavirus. And when you think of it as a coronavirus, you don't think it's pretty anymore. And the reason it's going round in circles is because it seems to have, kind of encircled us. We are, kind of surrounded by it, whether we are at home or whether we go outside. It's a virus which is predominant in our lives, and which is the virus which circles our lives completely. Now, when I think about the coronavirus, I also have I kind of start thinking about what people think about it, especially what youngsters think about it. So I had this online poll, which Gargi ma'am very kindly agreed to conduct. And I would like, you guys to reply to me that how many of you believe that you have less chances of having COVID compared to your parents? And ma'am, can we conduct this poll now?
Yes, doctor, already I have shared it and people have responded to also. The first one, do you believe that you have less chances of having COVID compared to your parents? Doctor, 61.5% said yes, rest said no.
Okay, so that makes it around 62% students believe that they have less chances. And so what is the age group of all the students? Are they all below 20, or some of them are above 20 as well?
Mostly below 20, 20, 21, like that.
Okay, right. So 62% of your students are actually right, because when we look at the distribution by age for COVID, then we actually see that the age group 10 to 19% have a 4% chance of developing coronavirus. But the moment they turn into their 20s and then into the third decade and then into the fourth and then the fifth decade, then the chances of getting corona and is definitely higher. So the students are right when they say that they have less chances of getting COVID. I mean, I absolutely agree with them, and they're right about that. But then what happens next? So these students have less chance of getting corona, and but do they, then become careless? Because what happens is that the little children that we have around in our homes, they kind of listen to us and they wear their masks, and then we wear our masks and the older people wear their masks. But it is quite commonly seen that the age group which we have in our colleges, the younger ones who believe that they won't get corona or they have less chance of getting the COVID virus, are they the types to not wear a mask? So my second question to you, how many of you socialize without a mask because you think it's too stifling? You
Yes,
don't have to
doctor,
be.
93.5% say no. They don't socialize without mask.
They don't. I'm so glad. So look, this is what the Americans have come up. My body, my choice. I'm so proud of you students, because if you said that you don't socialize without a mask, then actually you are very responsible. And it makes me proud to know that India's future lies in very secure and responsible citizens. Because you know what happens is that yes, the younger lot have less chance of getting the virus, but they are the carriers. They are asymptomatic, they probably won't have any fever, they may have a little bit of a dull ache on one day, one evening or two evenings, they may attribute it to playing or whatever, but the bottom line is that they're going to carry it back to their parents, their grandparents, or domestic staff, and that's where the storylines changes. That's where the storyline becomes serious, because we've seen so many people in families where the younger ones are fine, but the parents get affected and the grandparents get affected. So, all the young ones who are listening to this, please, please, please do not think of, like when you're chatting with your friends or you're just having a coffee, I know, just kind of keep a distance and have your coffee. And also, when you chat with your friends, do not remove your mask, because you are not likely to get affected, but you're going to carry that virus home to your loved ones. So thank you. That was good. And I'm so happy with the answer to this second round of opinion poll. So I wanted to share with you what this corona does. I'm not sure if Dr. Subhrojyoti has already shown this, but this is the normal CT of the lung. And when you take a tomato, think about when you take a tomato in your hands and you slice it horizontally. So think someone has sliced your lungs horizontally. So when someone slices your lungs horizontally, you see these black parts, and that's not bad. Black here is not bad. Black here is good. The more black it is, it tells us there's air there, and it's good sign. However, when someone gets infected with corona, the inflammation is so much, and the alveoli is completely infected. And what happens then is that of course, it kind of changes your immune reaction, and there's fluid accumulation in the small little air sacs that we have in our lungs, and then those air sacs can't breathe. Think of it like a balloon which is filled with sand, wet sand. I mean, a balloon filled with wet sand doesn't have any more space for anything to get in. You can't blow air into that balloon. So same thing is with the coronavirus. It's so scary to see people's lungs like that. And here you can see, only this part of the lung is actually still operational. And here you can see that the right side of the lung is infected. The left lung is also kind of less operational. So you get to see pictures like this, which are so scary, and they are called the ground glass appearance. It looks as if someone's taken glass and shattered it, and that's the appearance that you get in your lungs. So the reason, I don't want to scare you, I don't want to get into technical stuff with you, and I don't want to bore you, but I just want you to be aware that the COVID is like a flu, is like any other flu in one sense. For you, when it hits your body, it's going to be like a flu. It's not going to be like a flu. Then it's going to be like this, and you need to be careful with for people around you. So yes, it's your choice, your body, but for people around you, it's not their choice, because you're their family member. You harm you, and you would not even be aware that has happened, because you're not going to have any symptoms, and they are the ones who are going to show the symptoms. So this is what we do in the hospital. You know that Belle Vue's become a COVID hospital. And when I'm a physiotherapist by profession, we wear our PPEs and we go and we make people do a lot of breathing stuff, a lot of breathing exercise so that their lungs start getting operational. We have people in their
Dr.
60s,
Shabnam, sorry
70s.
to interrupt. Your slides are not visible. It's showing just a white background.
Are all the slides have not
Please
been
stop
visible
presenting and start.
or only this slide?
No. These are not visible. And you just stop presenting once and start again. It will be visible. Or else, ma'am, I can share on your behalf.
Okay. So I stop sharing, is it?
Yes.
I'm stop sharing. Okay, I've stopped sharing.
Okay. Yes.
Is
Now
that
please
good?
start sharing again, or else I can share whatever you want, ma'am.
You mean to say you haven't been able to see any
No,
of the slides
No,
so
ma'am.
far?
No, ma'am.
Oh gosh,
Oh,
why didn't you
I
tell
wrote
me?
it down. I wrote in the comment. Yeah.
But I had a full screen
Yeah, we
on,
wrote
so
in the chat
I
box.
couldn't see. I'm so sorry about that.
Is it visible now?
Not yet. Gargi, not yet.
Yes, I can. Yes, Gargi. Coronavirus COVID-19. I can.
Meenakshi, I can't see.
Yes, ma'am. Yes.
Yeah, we can see now. At that time, we were not able to see. Now I can see all the mother and the child and how many of you have got my body. I can see all it.
Ma'am,
Rule of
from this
physiotherapy
slide,
and everything. Yes,
Dr.
I can see.
Yes, Dr. Agarwal, from which slide? This is you have already explained, I guess. Dr. Agarwal, can you hear me? Dr. Agarwal, are you there?
Should I call her up?
Ma'am, I was about to call her. I think she's having network issues.
So I'll just call her back.
Yes, ma'am. Yes, doctor, are you there? Please unmute yourself, doctor.
Yes, I'm here.
Okay, I'll just share. Please tell me from where to start. I'll just. Poll thing we have done. We have shared the results of the poll. This lung thing you have explained from which slide, ma'am?
Yeah, move on. Yeah, next. Yeah, this one. No, the previous one.
Yes, ma'am, you can start.
Sure. So that's what I was saying was that, so when you go to a COVID ward and you see patients, you actually are looking at these people who are lying there fairly helplessly, and they're not being surrounded. I'm sure they don't feel they're being surrounded by human beings, because all of us are in that PPE kit. And for a patient to see just white figures moving around, and they themselves being in various stages of respiratory distress, must be so unnerving. And although the hospital staff and everyone tries their best to kind of keep it going, they do I think it's fairly disabling for the patient, and it must be very distressing for them as well. And that's where the coronavirus has got such psychological implications, because people eventually come out of it feeling scarred almost, because they've been through so much of trauma. So this is what the coronavirus can do to an individual. And even though we are there in the hospital, the one prayer that we have for each one of us is that I hope none of us have to go through this disease or suffer from this disease. So that's the reason I'm emphasizing even more that no, you don't want anyone that you know to be in this particular situation, and you would rather be careful and uh, you rather be careful and kind of hope and maintain all the social distancing, wear your mask, and then move on. Okay, next please. So the pandemic causes quite a bit of stress. And so it's like a vicious cycle. The pandemic causes stress, and the stress causes various other things. But first, let me find out. Let me see how many people are actually stressed here. So next. Who's more stressed? This was for the students. The student, you, or the teacher? So the student feels that they are more stressed because they have this burden of attending online classes, and they are like burdened with staying at home. They can't meet their friends, so they feel they are burdened. However, have you ever thought about the teacher, who apparently is a mature individual who has family commitments and has to conduct online classes, which can be such a nuisance at times because there are domestic chores and there are small children, or there's just so much happening at home. For them to concentrate on teaching is such a huge task. So therefore, here we have a combined group of who's more stressed. So whether it's you, the student, or whether it's the faculty or the teacher, at the end of the day, the stress doesn't do anyone any good. So next. And in turn, like I said, it's a vicious cycle. So if you have stress, it can actually make you further sick. And it can actually invite the virus to come to your body. It's almost like an open invitation. Next. So what happens is there's a physiological impact on breathing because of stress. And the body has, when there's a short-term stress, and during exams or things like that, then there's a fight or flight mechanism. And there is, how does the body respond? The body responds by fast, rapid breathing. Whereas when it's like a long-term stress, you're undergoing stress, you do breathing, but the breathing is very shallow. Now, next. So this is what happens when there's a stress. There's an area of the brain which is called the hypothalamus, and that gets activated. And immediate response to stress is the breathing becoming rapid. Then after some time, the breathing is rapid, but also it's like the rate increases. And then after that, long term, the breathing becomes shallow. So you must be thinking, what's the big deal about it? What if my breathing is shallow? What if my breathing is rapid? What's the big deal? But there is a big deal, because this is all connected with your body, your immune system, and your entire reaction to any kind of infection that you may be suffering from. So, here we are talking about preventives. So this is one of the main preventives. Let's move on. So again, simplifying a very complex thing is that oxygen has to enter into our bodies, where it has to generate ATP, which is adenosine triphosphate, and energy. Now, even the mitochondria, which is in our cells, which kind of is the powerhouse of the cells, these smallest of smallest bodies in our cells require oxygen. Now, if we don't breathe properly, if we get into a shallower mode of breathing, or if we go into a rapid breathing, then what happens is that your cells actually don't get enough material, or they don't get enough nutrition, and the result is that you don't have the energy, your immune system gets compromised. So next. So you need to actually do slow and full breathing, where you get positive physiological and cognitive changing occurring. And then not only does it promote relaxation, but it also provides you more energy, because each time you relax, you come back and bounce back with more energy. Now, here, there's another line at the bottom which says practice abdominal breathing. Now, what exactly is abdominal breathing? Move on. So you've got two kinds. So if you look at the left side, you look at diaphragmatic breathing, where when you inhale, the stomach or the abdomen moves out. When you exhale, the abdomen moves in. Now, when you breathe in this manner, when you breathe where your abdomen moves out and in, you're actually doing abdominal breathing, you are going to draw more oxygen into your lungs. However, there's a section of people who do chest breathing, where the chest wall rises up and down when you inhale and exhale. So when that happens, then you actually are still doing breathing, but you're drawing less oxygen in your lungs. So you actually are advised to do diaphragmatic breathing, where your stomach moves out and in rather than the chest wall moving out and in. Next, please. So you need to stay away and become a diaphragmatic breather. So initially, when we ask people to become diaphragmatic breathers, they kind of can't get the hang of it. The abdomen goes in while breathing, and they can't seem to get the concept of pushing the abdomen out. And I'm wondering how many of you are actually trying to see what is. So think of yourself like a balloon. When we inflate a balloon, or when we pump in air inside a balloon, the balloon inflates, and think your abdomen is like that. It's going to inflate then. And when you breathe out, or when you deflate a balloon, it kind of goes back, or it kind of becomes smaller in volume. So same thing about your abdomen. Next. About diaphragmatic breathing or abdominal breathing versus chest breathing. Now, the other aspect of breathing is whether you should breathe in through your nose or mouth, and it's recommended that you breathe in through your nose. So I think most of us do believe breathe in through our nose, but some of us, especially at night, breathe in through our mouth, which causes snoring, and then that's another story. But breathing in through your nose is better, because there is slower breathing, and the air that gets in, because it goes through the nasal passage and it's a longer passage down to the lungs, the air gets humidified. And you will find that when your nose is blocked and you do mouth breathing, how do you feel? Your throat becomes dry, you start coughing even more. So therefore, you want to get into a breathing, and along with that, you use your diaphragm for breathing and not your chest. So that's a lot of information on breathing, isn't it? And there's a lot of instructions for breathing, something which we just take it for granted and we just do it. So let's have a go at it. Gargi ma'am, can you move on? So I want all of you to kind of place one hand on your chest and one hand on your abdomen. And when you breathe in, just see which kind of breathing do you do. I mean, I would really like it if people switched on the videos and I could see that. But if you could just kind of place one hand on your chest, see which is rising. Is your chest wall rising? And this is an important message, given the fact that we are going through a pandemic which severely attacks the lungs. You need to sort out the pattern in which your chest wall is rising. Okay, next please. Oh, Gargi ma'am, can you move on? So I'm going to end the note to work on it. So in yogic terms, this actually means that you are talking about a force which is going to am I not audible?
I think there is some network problem, ma'am. So it's coming as disturbed. Yeah, the voice was broken.
The
Right now,
voice
you're
is
right.
disturbed
It's okay. No, the voice
or
was broken.
the
Right now,
screen
it
is
is
disturbed?
correct. It's coming. You're clear. No, we were able to make it, so you can continue.
Okay, fine. So what we're looking at is that so this actually is extremely vital for the body, and so pranayam is something which comes free to us. We can do it very easily at any time of the day or or any time of the night, for that matter, in case we are night birds. But this is what we is essential. So the things to prevent diseases coming to us is fairly simple. You need to just strengthen your insides, and they're done by simple methods of life, and you are ready to go and ready to conquer the diseases, maybe not the world. So can we go on to the next slide, please? Yeah, Gargi ma'am, next slide, please.
Ma'am, just a minute, ma'am. Just a
Yeah,
minute.
yeah, sure. Would you like me to present?
No, ma'am, we are doing it. Just a minute. Just a
Sure,
minute,
sure.
ma'am.
No issue. No
There's a
issue.
network issue. I'm just sharing it in 1 minute. Yeah. I'm from here.
Yeah, maybe just go to the previous one and then we can come down to this one.
Sure, ma'am.
Yeah, could you go to the presentation mode?
Yes, ma'am.
Right.
This one, ma'am?
Yeah. So this is what the pranayam does. It actually enhances and stimulates the immune system, and it improves the functioning of the cells, strengthens the cells, tissues, and glands and everything. And pranayam actually releases stress, anxiety, as well as depression. So it increases blood circulation, it also overall boosts your health and cures many health issues. So people believe that oh, what's a big deal about breathing? But breathing actually takes away your pain, and we use it in our clinic as well. If you deep breathe, it does help. And that's the reason why people who do pranayams actually can get rid of so many diseases. Now, I'm not from a yoga background, mind you, but the benefits of pranayam are so immense that they need to be spoken about, especially in the current pandemic, where people can just practice these simple things and boost their immune systems. Next, please. So you can, Gargi ma'am, you need to mute yourself. So you can become a complete yogi, where the complete yoga system actually is about uh, asana and pranayam, which we all know, but it's also about meditation, and it talks about yamas and dharna, which is like external disciplines, and concentration, which is extremely important in students. So niyam, which is which was extolled upon maybe in olden days, and people have actually now think, oh well, that's just so boring, and why do we need so much of disciplining? But see, I mean, look at what the world has come to today. It's the indiscipline of the world which has made us where we are today, where we are all in our own houses, not being able to get out. So here we are looking at a complete package. And again, as I said, it's just free for you. You can practice it at any time and boost your immune system, boost your concentration, improve your inner discipline as well as external discipline. And these are things that you need to do for life, rather than just for the time being. And these are things, practices, which kind of make you a more successful person. If you look at the biographies of all successful persons, this is what you will find, that there is a discipline, there is a level of a routine, and there is a level of meditation, and there is a unity between the mind and the body, which kind of propels you forward. So this is where you score over others. Okay, next, please. And I'm going to quickly speak about herbs and spices for immunity. And the first one amongst them is cinnamon, which is, uh, uh, can we go to the next one, please? Which is, if you mind, cinnamon has something which is called coumarin, and that's anti-inflammatory, antioxidant, and antiviral. So that's the reason why the Ayush Ministry had recommended cinnamon as one of the constituents of the kara that they are recommending. And that's not off the just off the shelf. It's not something which they just spoke and people was to follow. They did a quick clinical trial of people who were there, who had COVID, and they found that the people who were taking all these herbs and spices did better than the people who did not, and the recovery was faster, and they got discharged earlier. So cinnamon is good, and it's anti-inflammatory and antioxidant, and it's generally used for sore throats and hacking coughs. Next, please. The other one is our tulsi, and whether you pray it or you, ma'am, please, the text next. So whether you pray for it or whether you actually just consume it, but what you do need to understand is that tulsi actually has antioxidants. It's got a bioactive compound which is called eugenol, which has got antiviral, antifungal, antibacterial properties. And also it reduces stress and plasma glucose levels. So here we're talking about one simple leaf which has so many properties. Next, please. And what you can do is, which we used to do, people, when they would pray, they would add tulsi leaves or these holy basil leaves to water and place it before the gods and then consume it later on. Now the issue is whether, as I said, whether we pray or whether we consume. The bottom line is that it's a philosophy that you should imbibe, that tulsi is one of the best herbs that you can get. And with the COVID now and with the pollution levels that are generally prevalent in this city, this is a mind-boggling herb that you must have or include in your daily diets. Next, please. And the other is ginger. Again, you can see it's anti-inflammatory, antifungal, and anti-cancer properties. We all know about ginger. We know ki jab we have, cold and cough, we have a ginger tea. And but I'm not sure if anyone else knew that it is good for arthritis and gastrointestinal complaints and even depression. So one would think that, oh, listen, what's a big deal about it? Because we Indians tend to have loads of this in our day-to-day diet, but we tend to have it in very small quantities. So when you want it to have an effect on you, you need to have it in larger quantities. Next, please. Then is fenugreek, which is again a natural antioxidant and it strengthens the immune system. It can be had as a seed or as a dried leaf or as a fresh leaf. We have it in all forms. And fenugreek, next please. Fenugreek helps, again, it's got various properties of treating fever. Now, I do remember that COVID-19 or any kind of flu does result in fever. So you could actually just be having fenugreek seeds every day or to, ensure that you don't get fever. And if you get some mild fever, have fenugreek at that time. Next, please. So garlic has potent antioxidant properties, and the best way to have garlic is to chop and crush it before you consume it. You can, just kind of expose garlic a little bit to air, which has got oxygen, and then consume it. So then it works better. And that's why you need to chop and not have garlic as a whole. It also helps to enhance the absorption of vitamin B1. And so that's for a specific disease, not particularly any viral disease. Carry on, please. And my favorite is turmeric, because turmeric contains curcumin. And curcumin has major anti-inflammatory and anti-cancer properties, which are just so major. It's so well researched upon that any conference on inflammation is now incomplete without a talk on turmeric. Now, I am again might think that, oh well, turmeric is something that is there in my food every single day, so big deal. But turmeric, the haldi that we have in our food, has curcumin. So 100 grams of turmeric has between 2 to 6 grams of curcumin, which is not a large deal. So if you have anything which is like an if you have something like an inflammatory disorder of any kind, whether it be the joints or whether it be any other organ of the body, your best friend is curcumin. And again, curcumin is antidepressant, it's anti-aging, antimicrobial. I mean, the list just goes on. And you have curcumin bars in the US of A. People actually, instead of having vodka shots, people have curcumin shots. So that is how potent turmeric is. And I firmly believe that we need to go back to our roots to imbibe all this into our daily diets, rather than, we can have multivitamins, but this is something that if we can actually have it on a day-to-day basis, you are looking at long-term immunity development. Carry on. And last here is basically my favorite, because I am from the exercise fraternity, and exercise, immunity and COVID-19 pandemic, we actually are looking at the effect that exercises have in our body. Exercises at a moderate level actually reduce systemic inflammation, which means any inflammation in the body, exercises have the potency to reduce that. And by increasing things like interleukin-6 complements or immunoglobulins, which are basically markers which tell us how good or bad the body is vis-a-vis inflammation. Next, please. So acute exercise is an immune system which is actually adjuvant that improves the defense activity and metabolic health, and there's clear relationship between illness and moderate exercises. So it has an anti-inflammatory influence, and that's mediated through multiple pathways. It's very difficult to chart out all the pathways, and it's regular exercises which improves your immune regulation. So even while people are recovering from COVID, when we ask them that, were you following any exercise regime? Were you doing pranayams or some exercises prior to you getting infected? The ones who recover better are the ones who have been exercising routinely. It is a known thing that you do improve faster. So, it's the same thing, like if I have good food, will I never fall sick? Of course you will fall sick. If you have to fall sick and if you have exposed yourself, you will. But it's your recovery, it's your bounce back, which is faster if you have a disciplined life, which is good food, pertinent food, and good exercises and everything like that. Next, please.
Thank you so much. Thank you so much, Dr. Agarwal, for your such a detailed and informative presentation. Ma'am, we have few questions to ask. May I?
So I'm done. Yes, of course.
Dr. Agarwal, can you hear me?
Yeah, I can.
Yes, Dr. Agarwal, can you hear me?
Yes, she is able to hear you. Please carry on.
Yes, I can.
Okay. This question is from Dr. Rekha Nariwal, our respected professor. She has asked that, can physiotherapy cure hypertension, high palpitation, stress, etc.?
No, physiotherapy is not a cure. Okay, I answer that well. Can you hear me?
Yes, ma'am. There's a second part of the question. Can breathing exercise reduce high palpitation? Should one consult a psychiatrist to overcome depression? These are the two questions she is asking, ma'am.
So physiotherapy is not a cure for hypertension, but regular exercises are a management for hypertension. Then high palpitation and stress, again, the same answer is that regular exercises help you in all of this. Can breathing exercise reduce palpitation? Yes, breathing has a regulatory effect and it can reduce palpitation. Her next question is, should one consult a psychiatrist to overcome depression? So yes, one should, because if one is having depression, it's a good idea to consult a psychiatrist. But if you practice meditation and do regular exercises, they kind of they liberate some happy messengers from your brain. Some chemicals from the brain are liberated because of exercises or meditation, which therefore make you feel happy and which therefore overcome depression. I've answered them all.
Yes. Ma'am, there's another question. 1 minute, ma'am. Yes, it's like persons who are previously infected with one or more types of viral diseases like dengue or COVID, can they be infected again? If yes, then they are at higher risk or not?
No, it all depends upon your immunity. Now, once you've had a viral infection, you and your body has spent all its energy trying to cope with it. And again, so, it takes a time for the body to recover. And if you're exposed to the virus again, then you are likely to be at a higher risk.
Right, ma'am. Ma'am, next question is, when we cannot visit doctor, how can we contact them online? I mean, online consultation, is it safe? This is from Riddhiman Das. This question has come up.
I think as of now, online consultation are a great idea. We do it regularly. And of course, there is this feeling that the doctor didn't examine me and things like that. But it is good to at least have a consultation. And I think they are a great platform in today's day and age.
Yes, ma'am. Thank you. Thank you so much. These are the
I
questions
answered
we
that.
had, doctor. Thank you so much for answering all of them. I would request Meenakshi ma'am. Meenakshi ma'am, can you hear me?
Yes, I can.
Yes, ma'am. Now I would like to invite Meenakshi ma'am. 1 minute. Ma'am, please give your thoughts, ma'am. Please conclude this session. We had, we have covered all the answers and everything. We are done with that, ma'am. If you have any question or if you want to say speak something, so, ma'am, please do that.
I always have, Dr. Shabnam, one thing that I wanted to ask was that during the diseases or when we are sick, we are mentally depressed. Is there any particular way how we can come over that depression? Even after, recovery, the depression takes a lot of time. So are there any ways so that we can recover out of that depression?
Hello?
Dr. Shabnam?
Yeah.
Can you hear me?
I could.
Gargi, can you hear me?
I can. Can you not hear me?
Yes, ma'am, I can hear you, ma'am.
Thank you.
Okay. So that's very relevant.
I think Dr. Shabnam Agarwal is going to answer it. So,
yeah. So it's very relevant to people when they fall sick, they do get depressed, and it does take time. Yeah, I understand that, because the scare of falling sick, the feeling of inadequacy, not being able to do what you want to do, not being able to recover on time, the financial losses, the commitments not being met, all that takes a huge toll on people. But the bottom line is that one does have, these are, things that happen in life, and the only person who can help you is you yourself. And you yourself has to understand that this is a time bound thing. Once I recover, I'm going to be all right. So this is where your inner strength comes in. But I agree that not everyone can bring out their inner strength all the time. So then it's a good idea to consult a psychologist, not a psychiatrist, but a psychologist, and undergo some counseling sessions where you possibly, at times we don't understand our own selves, at times we don't understand what is actually our fear or what is bogging us down. So basically a few sessions with a psychologist would bring that out, and it's a way to move on and to recover from the initial illness.
Thank you, Dr. Shabnam. And that was the one question which was actually I was going through, as I have seen many of the people these days very depressed after even listening to the things that such a friend or a family member or someone suffering with COVID-19 especially. So I think that we will be able to convey this message to all. And to thank you is, I think, is a very small word, because you people have taken such a precious time out of your busy routine. I know that. And it was such a wonderful session with us, because not only that we kept on hearing, but it was directly the questions were answered, and so many of our curiosities were satisfied. And we always feel that the doctors are God, but I also now feel that the doctors are the big healers, because the way you have presented it, the way you have given your presentation, the advices that you have given us was really great. I'm sure that everybody is going to take a lot out of this webinar. Thank you, Dr. Shabnam. And of course, Dr. Bhowmick is not there. Thanks a lot for a wonderful presentation from his side also. Thank you, all the participants who are here, and my technical team, Gargi, Vivek, and Divya, Gaurav, who have worked so hard for it. Thank you, Dr. Shabnam. I hope so that we will be meeting again, once again, maybe physically now, not virtually, in the college sometime very soon. We really want to hear you more
Sure,
on the
that'll be such a
physiotherapy side
pleasure.
and on the fitness side. Thank you, sir.
Sure,
And
absolutely. Thank you
you,
so much for the
the
invitation. It was a pleasure.
Thank you very much. So, Gargi, we bring to an end.
Thank you so much. I just like to, yes, ma'am, I just want to conclude it with one thing. This is an awareness program that we had. So no feedback, nothing, but after this session, what we have learned that we can see through a small quiz, a 3-question quiz. I have provided the link in the chat box. Dr. Bhowmick has shared this question. So please, participants, fill up that particular form, and we can see that how much we have learned from this particular session, how much aware we are now. So please fill up that particular form. Thank you so much. Thank you, ma'am. Thank you, everyone. With this, we are at the end of the session. Thank you, everyone. Yes, Vasundhara ma'am, I can see your thumbs up. Thank you. Thank you, Dr. Agarwal. Thank you. With this, we will conclude this program. Thank you. Just
Sure. Thank you.